Good afternoon, everybody. I want to thank everyone for taking the time to come out and tour the Wellness Center today, the FirstLight Community Wellness Center. Particularly want to thank Kirsten from the Times, our Chamber of Commerce, Mora Public Schools representatives, our county commissioners, Jack, our mayor, Mora City Council members, local businesses, and of course all the community members for supporting this facility. For those of you who don't know who I am, my name is Terry Higgerness. I am the FirstLight Board Chair and also the Vice President at Neighborhood National Bank. As a board, we decided to work with the school district on this project because it would give us a facility that would support our mission to improve the health of our community, but by providing the walking track and the running track, and the fitness area, educational opportunities, and nutritional counseling and strategies. Because regular exercise and well-being is essential to good health. Excuse me. My husband and I and my son have been using this facility since it opened, and we have been able to put on a lot of laps in this facility. It's been fantastic, especially with the spring that we had that was not very conducive to being outside. And another time that we're hoping to use it is when it gets a little bit hotter and a little humid to not be walking outside. We'll be able to come here in the nice, cool atmosphere. I've also had a chance to interact with a lot of our community members while walking around the track, and I've heard many compliments about what this facility has done for our community and what it can do for our community. And with that, I'm going to turn it over to the CEO, Randy Alseth, who will be speaking about the Community Wellness Center and what the support, the changes in healthcare coming forward. Thank you.
Hello, welcome, thanks for coming. I am going to, as Terry mentioned, I'm going to talk a little bit about some changes in healthcare. But I want to start with introducing the FirstLight Board, the ones that made the decision in the infancy of this project to invest significantly in the health and wellness of our community. They are, and you just met Terry. I'll ask the board members when I say their name to stand up. Three of them are here. Terry Hagerness, Pete Donner, Kim Smith, Jack Schwinghammer, Paul Kent, Kathy Ellis, Amy Anderson, Becky Steffen, and Carl Peterson. Thank you, guys. I also want to thank the school board and administration for their support, work, and commitment to make this center a reality. So thank you, guys. I'd like to talk a little bit about why this wellness center, kind of why now, and why the programs that we're going to put on here are important. At this point, I was going to go into a long lecture on Medicare, the Medicare program, and why it doesn't work. My wife suggested I don't do that, so I will save you the pain. But because of the Medicare system and what has transpired over the last 60 years, healthcare is changing significantly. In the past and up to today, we've been paid based on the number of services we provide. So if in any given week we did 50 MRIs, we get paid for 50 MRIs. This we call pay for volume. The more we do, the more we get paid. In the future, we expect to get paid a fixed amount for each month to care for our members. This will align our financial motives with our mission. I think Terry mentioned our mission, but it is to improve and support the health of the communities we serve. And certainly that's what we'll be doing when we're focused on your health. This is what we call pay for value. So how do we do that? Page 2. Well, this is where the Wellness Center comes in. The healthier our habits, our ability to exercise, and our motivation to improve our health, the less healthcare we consume. The facility and the wellness programming we will provide here will move our communities toward health and wellness. We are seen as leaders in the industry when it comes to wellness because of this center. In fact, I've already toured several community boards, health system boards, around this center, and I know of a couple that are now having committee meetings on figuring out how to do what we got done. This is a start to a change in healthcare, focusing more on healthcare and less on sick care. I'm proud of our community for leading the way. Thank you. I hope you enjoy the evening. Now I believe Karen's school board chair is going to come and say a few words.
Hello, everybody. Does this pick it up if I don't?
Yeah.
You don't have to turn it. As Randy said, I am Karen Kirschner, and I'm currently the board chair of the Mora Public Schools Board of Education. I too want to thank you all for being here today on what is really an exciting day for our community. And if you are seeing the new FirstLight Community Wellness Center for the first time, I think you'll be impressed, and I really encourage you to take a good walk around and see what opportunities it offers to all of you. Along with much needed space for educational purposes as far as physical education, classrooms, and athletics, I would just encourage all of you to take advantage, as I said, of the opportunity to come in and walk anytime, and in addition to also take advantage of the open gym times that are designated to come in and participate in other activities. As time goes on, I think we're going to see truly what an asset we have in this facility for the community, and it'll be for residents of all ages and a benefit to all of us for many years to come. The addition of the Wellness Center to the educational facilities also aligns well with our school district's strategic plan, and I specifically want to speak to two of our belief statements, and I'm going to read them. We believe partnerships, students, staff, community, and family are vital to educational success. And the second one that I think fits real well is we believe in providing opportunities in academics, arts activities, and service that promote lifelong learning. Since we as a school district continuously promote lifelong learning, beginning with early childhood and family education, including pre-K through 12 education, as well as adult learning through community education, the construction of this facility offers an additional means of fulfilling that belief of lifelong learning. And since you are all lifelong learners in this community, it applies to you. I also need to take a minute to introduce our school board. And we as a school district continuously, I guess what I really need to do is thank FirstLight Health System first, along with its Board of Trustees and Brandy and all the staff for partnering with us in this opportunity. And we as a school board have really enjoyed working with them. It's been a good process and provided an opportunity that we have discussed many times, only been able to dream of doing anytime soon on our own. And so before I close, I would like to introduce the current members of the Mora School Board as well. So we have Ethan Elvigem, he's out here, and the rest of you are back here. If you would just stand, please. Bob Woods, Tammy Bohacek, Scott Moe, and Bob Jensen. So in closing again, I just want to thank you all for being here today. I want to thank you also for continuing to support public education and your commitment to the kids of this school district, and along with us as a school board, supporting what is best for the kids and all of us lifelong learners here in the community. Thank you.
Well, as the wind picks up, you don't get to hear page 2 and 3 of my presentation. But first of all, I'd like to thank Randy's wife for advising him not to go into too much depth on the Medicare pay plan. As Randy had mentioned, the hospital board and the school board have really stepped outside the box. When we first started talking about this, it started with our Mora elementary program. We were starting with our early childhood, our earliest learners space, and at that time in the design process, it was mentioned to us that FirstLight was moving into a building project and they might be interested in some similar space. So I went and talked with Randy and said, what do you think about the potential of doing a joint project? And he said he was interested, but he would have to hear more about it. And so from 2 courts, we're up to 4 courts with an indoor running track, walking track, office space, and what we have today, the completed project. When you think of the public education part, we think of just the K-12 education, but we also deal with preschool and the community education, as Karen had mentioned. So this is not only for school-age children, but also for toddlers, all the way up through senior citizens. We have a part within our process that expands beyond just the community and our education here locally. This facility has also served track meets for Ogilvie, Hinckley-Finlayson, Pine City, Bram, Rush City, Cambridge Isani, have also rented space and time for tennis practice and track practice. So we're not only just serving the school-age children in the Mora community, we're also serving the communities around us. The weather is no longer an issue for us. It's no longer an issue for you. If you choose to walk or run, you can do it. It's 70 and sunny every day inside the Wellness Center. As these other communities come to Mora, they're coming for competition, but they're also coming for cooperation and collaboration. These are very valuable skills that our students are learning as young people as they prepare for the workforce and to become productive members of society. Our communities, plus our neighboring communities, create a center of activity, which in turn promotes a thriving community. I know there's been a lot of thank yous said today, but I'd also like to thank the Mora School Board, as well as the hospital board, for being willing to step outside the box. As Randy and I were talking about this, I asked him if there was another hospital in the state of Minnesota that we could look at, a model of, and there wasn't one. Checking with the Minnesota Hospital Association, this is the first one of this type within the state of Minnesota. I'd also like to thank Wold Architects and ICS Construction Management, who were our team to help provide a quality project that came in on time and on budget. Also within that, we had a large team of people within technology and food service, within our activities, from our coaches. You don't realize all the details that go into a facility like this until you really get into building one. All of the components, you get to see what's on the outside, but there's so many things on the inside. When I say the inside, I mean inside the roof, inside the walls, inside all of the various components. So I'd like to thank Wold Architects and ICS Construction Management as well as our team that helped us go through that process. Again, of coaches, activities directors, technology, and all the various components. And with that, now that the wind has died down a little bit, we can get on to the ribbon cutting.
Yeah.